today's healthcare environment, protecting patient information isn't just best practice, it's a legal, ethical, and operational necessity. Every interaction, from a simple check-in at the front desk to a detailed conversation about treatment, carries the responsibilities of safeguarding protected health information, or PHI, and as healthcare becomes more digital and more fast-paced and more interconnected, maintaining patient confidentiality has become more challenging than ever. HIPAA lays out the rules, but real privacy protection comes from understanding where breaches actually happen and what safeguards prevent them. Patient confidentiality isn't just a regulation, it's the foundation of trust in healthcare. Under HIPAA, providers must protect all personal and medical information and only disclose it when necessary for care or when required by law. When patients feel confident their privacy is respected, they're more honest, more comfortable, and more engaged in their treatment plans. Still, breaches occur far more often than people realize, about every 62.5 hours. That's roughly every 2.5 days. Why so often? Because accidental exposure can happen in busy offices through unsecured paperwork, casual conversations, or even simple curiosity. That's why healthcare workers rely on practical, everyday safeguards to prevent unintended disclosures of PHI. One example is patient check-in. Sign-in sheets are often designed to hide previous names or use removable labels so other patients can't see who checked in before them. This prevents situations where someone recognizes a name and unintentionally exposes sensitive information. Another example is voicemail messages. Practices intentionally keep those vague. No appointment times, no procedures, no results. They stick to the patient's name, the provider's name, and a callback number to avoid revealing PHI if someone else hears the message. Physical protections matter too. Privacy windows at the reception desk help prevent people in the waiting room from overhearing sensitive conversations or phone calls. Staff can open them to interact with patients and close them when discussing private information. Document disposal is another major area. Paper files that contain PHI cannot be tossed in the trash. They must be shredded. Many offices use secure shredding bins to prevent piles of unsecure documents from building up, getting misplaced, or getting thrown away accidentally. And of course, the safest long-term solution is switching from patient records to fully digital systems. Visitors present another confidentiality risk. Before discussing sensitive information, providers must confirm whether a patient wants visitors in the room. Consent protects the patient's preferences and prevents accidental disclosures. There are, however, situations where confidentiality can be legally breached. Healthcare professionals may disclose information to prevent harm, report child abuse, respond to a public health crisis, comply with court orders, or consult another professional for treatment. Even then, only the minimum necessary information can be shared. Protecting confidentiality requires constant awareness. Regular HIPAA training, strong privacy practices, and clear communication helps ensure employees stay compliant and patients stay protected. And beyond just the legal requirements, strong confidentiality practices also improves the overall patient experience. When the patients know that their information is handled with care, from how the records are stored to how staff communicate to how conversations are conducted, it builds trust and increases their comfort within the healthcare system. This trust leads to better health outcomes, smoother operations, and fewer costly mistakes, making confidentiality essential for not just compliance, but for quality of care as a whole. If your organization wants to learn more about how to protect your PHI, reach out to Tactics. And since you've made it this far into the video, you might as well like it, share it, and comment down below.